This is the first presentation about the muscular system, and the presentation is going to address the very basic principles that we need to understand the muscular system. It is a brief introduction, and we will learn more when we go through the muscular system. In order to understand the muscular system, we need to know the following. We must have good knowledge of synovial joints. These are the most movable joints, and we need to know the specific movements, because we are going to talk about muscles producing these movements. Expansion of knowledge comes from asking questions, many questions, and we should ask ourselves questions before others ask us. And when we ask questions, we should get answers, and we learn a lot from these answers, and there are always more questions than answers. Muscles are arranged in groups. Very rarely a single muscle does a single action. They almost always come in groups, and this group or these groups, they move joints or other structures, and muscles have the power of pulling. They pull bones around joints, and each muscle has a main action and may have a minor action or two. The bottom line is that muscles work as a team to do a function, and that function is usually movement, and this is how we can move our joints and do our daily activities. And remember that muscles action is a force that has directions. There is in physics no force without a direction. Now we know that muscles are arranged in groups. The head has its own muscles, the neck has its own muscles, so are the arms and the legs and the abdominal wall and the back. Now, the top priority is the group that helps the process of respiration. So we are going to address this group of muscles first. What is the main respiratory pump? What is the main agonist that is going to produce the inspiration? Good question, isn't it? And the answer is the diaphragm. The diaphragm, the thoraco-abdominal diaphragm, the one between the thorax and the abdomen. Let us start with simple classification and simple idea about the respiratory muscles or the breathing pump muscles. These muscles are usually attached to the ribs, and there are inspiratory muscles and expiratory muscles. Now the inspiratory muscles, that is going to help expanding the thoracic cavity to help taking the breath, and there are primary inspiratory muscles. And the main one, of course, is the diaphragm, plus, as a team, external intercostal muscles. As the name indicates, according to the basis of naming muscles, external is location, it is on the outside, and intercostals or intercostal muscles indicates the location. It is between ribs, and the space between ribs is called intercostal space. And there are muscles that help the inspiratory muscles, and these are called accessory inspiratory muscles. Then we come to the expiratory muscles. Now, in physiology, we learn that expiration is passive. It does not really need muscles, but sometimes we need forceful expiration, as in coughing. And remember again, normal expiration is a passive process, and these muscles that help forceful expiration, not normal expiration, they compress the thoracic cavity, and these are internal intercostal muscles. The external ones are inspiratory. The internal intercostals are forceful expiratory muscles, plus the abdominal muscles. And we need to know more, because breathing is a very important process. Let's have an overall image of the diaphragm. The diaphragm separates the thoracic cavity from the abdominal cavity, and it is dome-shaped structure. It takes origin from the lumbar spine and the base of rib cage and the sternum. These areas, they give origin to muscles, and these muscles, they go up and they meet in the center and form a central tendon. Now, when these muscles contract, the central tendon will come down. As it comes down, it increases the volume of the thoracic cavity. This is an inferior view of the diaphragm, where we can see that the fleshy muscle fibers are at the periphery, and the tendon, what is called the central tendon, is the whitish area in the center, and you can see there are 3 holes in the diaphragm. More details about the origin of the diaphragm. But to start with, we can see that the periphery is made of muscles, and the central part is what is called the central tendon, and it has 3 parts, one on the right, one in the middle, and one on the left. And we can see that there are 3 holes. One on the right is for a big vein coming from the lower part of the body called inferior vena cava, and in the center and in the upper part we can see an opening for the esophagus, and then lower down an opening for the aorta. First of all, what is called the vertebral origin, and it is called a crus. So here we have a crus of the diaphragm. It comes from the upper vertebrae of the lumbar region, and it goes up and gives fleshy muscle fibers, and this crus or the lumbar part is going to curve around the esophagus and goes to the central tendon. Then we have a small connective tissue around the aorta, and this is in the form of an arch. Therefore, it holds the description of arcuate, and because it is in the exactly in the middle line, it is going to have the name the median. So this is the median arcuate ligament. It also gives origin of muscle fibers. Then on the left we have another crus coming from the upper lumbar vertebrae, and this is called the left crus, which is going to give origin to muscles of the diaphragm. Then if we look here, it's an arch and nearer to the midline, therefore it is going to have the name arcuate and the relation medial and not median, because median is exactly in the midline. So this is a medial and arcuate. So this is the medial arcuate ligament. It is whitish because it is made of the fascia of the muscle coming under the arch, and this is the psoas muscle, and we will see the psoas muscle later on. Then we have this arch again. So this part giving origin to the diaphragm also have the name of arcuate, and it is lateral. So this is the lateral arcuate ligament. It is a thickening of a fascia of a muscle called quadratus lumborum. Don't worry, you are going to see this muscle. Then we have ribs and costal cartilages. They give origin to the diaphragm, and as we reach the anterior median point, we will find the xiphoid process of the sternum. It also gives origin to the diaphragm. The diaphragm has 3 openings. Now, this one here is described as median, and it allows the passage of thoracic aorta when it comes and becomes the abdominal aorta. And there are 3 structures around it. On the right, it is the right crus of the diaphragm. On the left, it is the left crus of the diaphragm, and on top of it is the median arcuate ligament. Then we have the opening for the esophagus, which is higher up, and this opening is under the curve of the right crus of the diaphragm, which acts, as we will know later on, as a valve preventing contents of the stomach to go up. The one on the right in the central tendon. The other two are not in the central tendon. This opening for the large vein bringing blood from the lower half of the body, which is called the inferior vena cava, is the highest, and it allows the inferior vena cava to go and empty into the right atrium of the heart. Here is an image for you where the diaphragm is viewed within the rectangle. It is for you to practice your knowledge. I am not forgetting the time of sitting down and writing notes about what I have seen. And I've seen the diaphragm, and I've seen the starting point of the diaphragm, which is the origin, and it is the xiphoid process, most anteriorly in the midline, then the costal margin, the costal cartilages and ribs, and then fascia over the quadratus lumborum. And you may remember that this is an arcuate and this is lateral, therefore it is the lateral arcuate ligaments, one on the right and one on the left. Then the fascia over the psoas major, the medial arcuate, and it is the medial arcuate ligaments. And then the vertebral bodies of L1, L2, and L3. These are going to make the crura. The crura is the plural of a crus. So the left crus is coming from L1 and L2, while the right crus is coming from 3 lumbar vertebrae. Where are these muscle fibers going to end up? They end up at the central tendon of the diaphragm. And when these muscles contract, they pull the central tendon down and push the abdominal organs inferiorly, and that is going to increase the volume of the thoracic cavity, and that is inspiration. And and here is the same principle. The green muscles are the external intercostal muscles. The red ones are the internal. And as we have just learned, the external will stop before reaching the sternum, and the gap is completed by a membrane, and this is the anterior intercostal membrane, bridging the gap between the external intercostal. Question: what is this athlete doing? She has run a long distance, and then the process of respiration is stretched to the limit. Therefore, she needs extra muscles to help herself breathing. So what does she do? She fixes her upper limbs on the lower. That means it is fixing the humerus and fixing the scapula. So muscles attached to the humerus and the scapula, they come from ribs, so they change the origin and insertion into the opposite. So this is going to help expand the process of respiration. You can see lots of athletes, when they do great effort, they have this position. These muscles that this athlete was using is called accessory inspiratory muscles. Now we have group of muscles. There is no use of mentioning their names because it's going to be strange for you, but we will see some of them. So we have a bunch of muscles that are called to do inspiration in emergency cases, and these are called accessory inspiratory muscles, and we are going to learn more about that. Then we have accessory expiratory muscles as well, and these are the abdominal muscles. When we cough, we need extra expiratory muscles, and when you cough, touch your anterior abdominal wall and see how it is contracting. We will be talking about these muscles quite soon, and these are muscles of the back. This is a side view of the trunk, and we are going to deal with the muscles of the anterior abdominal wall. What is this zigzag line? This is an indication that this muscle is going to take origin from the lower ribs. Then it is passing free from the lower ribs to the iliac crest, and it is attached to the iliac crest and goes anteriorly towards the anterior superior iliac spine, and then it jumps to the pubic tubercle of the body of the pubis, and then these fibers are running downward and medially as if you are putting your pocket, your hand in your front pockets. And this muscle goes laterally and then reaches the midline and forms the white structure you see. This is a flat tendon which is called an aponeurosis, and it is inserted in the midline of the anterior abdominal wall. This is a description of the external abdominal oblique muscle. Why external? Because it is the outermost. Abdominal is its location, and oblique is a description of direction of the muscle fibers. Now, this muscle has a special feature, and that is what is called the inguinal ligament. This is a structure that is representing the free edge of the external oblique muscle, where it turns around itself medially and forms the inguinal ligament. Let us write some notes about the external oblique muscles of the anterior abdominal wall. It is the largest muscle of the anterior abdominal wall group. It is the most superficial, and it is flat muscle. Have we noticed that it is flat muscle from the figure? The answer is yes. And the fibers run inframedially, as if you are putting your hand in the front pocket of your trousers. And have we seen that? Yes, we have seen that. And it comes from lower ribs 5 to 12, and that was documented. And it inserts into the iliac crest and pubic tubercle and goes anteriorly to join the other muscles. And when it contracts, the trunk rotates to the other side of the direction of the muscle fibers, and it is innervated by the lower intercostal nerves. When we remove the external oblique muscle of the anterior abdominal wall, we are going to see this muscle. This muscle is coming from ribs 10 to 12, the lowest two ribs, in contrast to the external oblique, which extends from higher up, the lower ribs from 5 to 12. Then it is going to take origin from the lumbo-dorsal fascia, which is extending from the lumbar region, the white structure you see to your left, while the external oblique was having a free edge. Then, as it comes to the iliac crest, it is attached to the iliac crest, and then as the iliac crest finishes anteriorly, it is going to take origin from the inguinal ligament, the reflected lower part of the external oblique, and then the pubic symphysis. It is not the pubic tubercle or the pubic crest. It is going to be attached to the pubic symphysis and then goes anteriorly to be inserted in the midline of the anterior abdominal wall, which is whitish in color. Therefore, it is called linea alba. And the xiphoid process of the sternum, and the direction of muscle fibers is perpendicular to the direction of the external oblique. In the external oblique, as if we are putting our hands in front pockets, the internal oblique muscle is in the direction of putting our hands in the back pockets. These are the nodes that are noticed from the image of the internal oblique muscle. If we look at this muscle, which is the deepest of the three in the anterior abdominal wall, it is coming from the lower ribs and the dorsal lumbar fascia, and then the anterior 3/4 of the iliac crest, and then the lateral 1/3 of the inguinal ligament made by the external oblique muscle, and it is also have attachment with the xiphoid process, and then it goes and joins the linea alba. Now we know what is the linea alba, and forms with the tendon of the internal oblique. As they join together, they form what is called the conjoint tendon. Conjoint means that two muscles join their tendons together and comes to the pubic crest and then runs towards the anterior part of the anterior abdominal wall, and it is attached to the linea alba. Why is this called transversus abdominis? Because its fibers run transversely. This muscle is a strange muscle, and it extends from the xiphoid process and the costal cartilages of 5, 6, and 7, and the fibers are parallel and they go down, but there are intersections of tendons between different parts. So this is a special feature of this muscle. It has tendinous intersections, and then as it comes down, it is attached to the pubis and pubic symphysis. This is the rectus abdominis muscle. It is long, found on either side of the midline, splits into two by the linea alba, and its lateral border is called linea semilunaris, while its medial border is the linea alba, and it is intersected by fibrous strips. These are called tendinous intersections, and it comes from crest of the pubis, inserting into the xiphoid process and costal cartilages of ribs 5, 6, and 7, and its function is compressing the abdominal organs and stabilizing the pelvis during walking, and depresses the ribs. You know, depressing the ribs is an expiratory process, and it is innervated by the nerves of the intercostal spaces. T7 to T11.